So here I'm going to talk about communicable diseases. The first one is rubella. Other name is called measles. The organism that can causes the measles, it is called Paramyxovirus. And incubation period 10 to 20 days. The source of infection usually respiratory tract secretion, blood, or urine of an infected person. How it is transmission? Measles can transmit direct contact or droplet. They said it is airborne disease. So airborne particles or surfaces, if direct contact with infected person or droplet, it is easily transmitted to the others. So airborne precursor we have to follow, like patient must wear N95 masks or respiratory masks. We need to give negative pressure inside the room, and we should keep the door closed, and also limited transport. Here showing what are the presentation of rubella or measles. Sometimes patient complain of fever, malaise, and cough, conjunctivitis, or coryza. So easy way to remember 3 C's. C for coryza, cough, and conjunctivitis. And in this picture, we can see the rash, and this skin rash appeared as red, erythematous maculopapular, and eruption starting on the face and then spread downward towards the feet. So in this picture, we call cup-like spot. This is the very key symptom. So you see, this is the scab-like symptoms in measles. Small red spot with a bluish white in the center and red base. They are located on the buccal mucosa and last for approximately 3 days. So complex spot is a key symptoms of measles. Basically, it is present inside the mouth. And in this picture, rash that start from the face and then spread down towards the foot. So if my patient have measles, what are the intervention? We use airborne and droplet precursor if the child is hospital. Also restrict the child to quiet activities, bed rest. Use a cool mist vaporized for cough and coryza, and dim the light because of photophobia is present. Admin antipyretics for fever as prescribed. The second disease, it is called rubella. So the organism can cause rubella. It is human herpes virus type 6. So incubation period is 5 to 15 days. So when any organism like human herpes virus infected the person, it takes 5 to 10, 15 days to Presentation, the sign and symptoms. Source and transmission is unknown. And what are the presentation? Sudden high fever. Body temperature is greater than 102 Fahrenheit. 3 to 5 days duration in the child who appears well, followed by the rash. It is called, you see the rash in the picture? Rose pink macules. And this rash appears hours to 2 days after fever. And this rash usually starts from neck. So if my patient has a communicable disease like Rubella, intervention is that give them supportive care. What does it mean, supportive care? Means if patient has a fever, you give them antipyretics medication. Other disease is called Rubella. Other name of Rubella is called German measles. The organism can cause rubella. It is called Rubella virus. Incubation period 14 to 21 days. How it can transmit, or what are the source? German measles can transmit by droplet. So droplet precursor is important. Like wear the surgical masks within the 3 feet of the patient. Private room is important, and patient wear surgical masks during transport. Limit the transport. And it is transmission occur direct contact or droplet, usually nasopharyngeal secretion. The virus is also present in blood, stool, or urine. So it is transmission by airborne or direct contact. The Rubella side symptom, the key symptoms, patient red rash. You see this picture, red rash that start on the face and then spread to the rest of the body and can lead to birth defect in pediatrics patient. Usually presentation is low-grade fever, malaise, pinkish red maculopapular rash that begin on face and spread to the entire body within 1 to 3 days. Petechia, pinpoint spot, may occur on soft palate. Intervention, use airborne droplet precursor if the child is hospitalized. Provide supportive treatment and isolate the infected child from pregnant women because it's a communicable disease. So here we see the compare and contrast between 3 diseases. So Rubella, also called measles, and Rubella is called German measles and Rubella. So Rubella, usually patient presentation, conjunctivitis, cough, and coryza, 3 Cs. And key symptom, patient has a cough-like spot on buccal mucosa. So tiny white spot in mouth, and Rubella rash that start from face and spread down. Rash appears at the hairline and spread Cephalocaudal means from center to periphery, head to toe, over 3 days. It is characteristics of rubella. And rubella, other name is called German measles, direct contact or droplet. The key symptoms are lymphadenopathy, lymph node enlarge, headache, low-grade fever, sore throat, or coryza. And you see the spot start in the soft palate. Right? The red spot, they start on the face, then spread to the rest of the body and can lead to the birth defect if mother is infected. Reds begin in the face and spread the cephalocaudal area. And roseola, the last one here, affected young children 6 to 36 months old and caused by the human herpes virus type 6. Patient has a sudden fever. After fever subside, a rash develop and starting on the neck and tongue and also spread to the face and extremities. What next? Next one, I'm going to talk about the mumps. Mumps is a common area to ask in NCLEX board exam. So NCLEX board like to ask the question from mumps. It is very important. The organism can cause mumps. It is Paramyxovirus. And incubation period is 14 to 21 days. It is communicable period immediately before and after parotid gland swelling. So in this picture, we can see the swelling of the parotid gland. And the source, the saliva of infected person and possible the urine. How it is transmission? Direct contact or droplet spread from infected person. The key symptoms usually painful, swelling parotid glands, and patient develop fever, malaise, and can lead to deafness or can lead to orchitis or can lead to encephalitis. This is the complication of mumps. Let me read it. Fever, headache, anorexia, jaw or ear pain aggravated by chewing, followed by parotid glandular swelling, or patient develop orchitis. Orchitis means inflammation of the testes. Also, septic meningitis may occur. So, if my patient have a mumps, what are the intervention? Mumps is airborne droplet, so we have to follow air droplet precursor or like surgical marks. If we give within 3 feet of the patient, give them private room, and also prevent the wear surgical. Patient must wear surgical masks during transport and limit the transportation. Provide the bed rest, provide enough food that is required, avoid the food that required the chewing, apply hot and cold compression to the neck, apply hot and local warm and local support. Also monitor closely for sign of aseptic meningitis, a complication of the mumps. So what are the other complications of the mumps? It can lead to deafness, orchitis, encephalitis, and meningitis. So important to management. The next disease is called chicken pox. Other name is called varicella. So varicella, organism name is varicella zoster. And this is the airborne disease. So airborne precursor is need to follow. Incubation period is 13 to 17 days. And source, respiratory tract secretion of an infected person or skin lesion. How it is transmission? Direct contact, droplet, or person, infected person to contact with other in fresh cases. So contaminated object also. So what are the key symptoms? Usually patient develop high fever, malaise, and also anorexia that are followed by a macular rash that first appear on the tongue and skull and then move to the face and extremities. So macules that turn into papules, that vesicles, and child is no longer contagious after vesicle have casted over. Usually it is called pustules begin to dry and develop cast. When cast means my children is no longer contagious to others after the vesicle have casted. And this skin lesion appear on macular mucous membrane on the mouth, genital area, even rectal area. So if my baby have a chicken pox, it is a communicable disease. What are the intervention? In hospital setting, make sure strict isolation, contact and droplet, both precursors we have to follow. If in the home setting, isolate the infected child until the vesicle have dried. Sometimes antiviral medication like acyclovir can work, may be used. And also we provide supportive care. Isolate high risk children, such as the children who have immunosuppressive or immunosuppressive disorder like leukemia, or from a child with a communicable disease. This next disease is called pertussis. So pertussis also we call whooping cough. The organism that cause pertussis are Bordetella pertussis. Incubation period is 5 to 21 days, and the source discharge from respiratory tract of the infected person. Transmission, direct contact or droplet. And droplets spread from infected person in direct contact with freshly contaminated objects. So what are the key symptoms? Symptoms of respiratory infection followed by increased severity of cough with a loud or whooping inspiration. May experience cyanosis, respiratory distress, and tongue protrusion. Right? So the key symptom, cold silent symptom. Then patient is violent, dry, or hacking cough with a whooping sound. Intervention, isolate the child during the catarrhal stage. When the infection is active, it is good to isolate them. If the child is hospitalized, always airborne, droplet, or contact precursor we must follow. So infection control should be notified every time a patient with a communicable disease is seen, and not it is got to maintain the proper cohorting. And we do not cohort post-operative patient with anyone experiencing like nausea, vomiting, diarrhea, open wound, or chest drainage or infection. Next is intervention. We reduce the environmental factor that cause the coughing, like dust, smoke, sudden change of temperature. Adequate hydration and nutrition is important. Who has whooping cough? Provide humidified oxygen, monitor cardiopulmonary status. Infants do not receive maternal immunity to pertussis. The tetanus diphtheria pertussis DTaP vaccine should be admitted to the women in postpartum period, those in close contact with the infant, to prevent the spread of pertussis to infant. Now we are going to talk about the diphtheria. So diphtheria, organism name Corynebacterium diphtheriae. Incubation period is 2 to 5 days. And the source, discharge from mucous membrane to the nose or nasopharynx, skin, or other skin lesion. So in this picture, we can see the pseudomembrane in the posterior pharynx. So pharynx is the part common continues with the larynx and respiratory tract, and it can become very large and may obstruct the airway. This is in case of diphtheria. In this picture, we can see the diphtheria, and here is huge swelling in the neck area, and here showing the cutaneous diphtheria that is attack the skin. Cutaneous. So cutaneous diphtheria is a contact precursor. But if the diphtheria in the pharynx, it is droplet precursor. Important to know. So this is the diphtheria in pharynx, droplet precursor. This is diphtheria in the skin, cutaneous, it is contact precursor. What are the signs, symptoms? Low-grade fever, malaise, sore throat, foul smelling or maculopapular nasal discharge, dense pseudomembranous formation in the throat that may interfere with eating, drinking, or breathing. This is the pseudomembrane formation. And also, patient develop lymphadenitis, neck swelling, and we call bulk neck. What are the intervention? First of all, isolate the patient. Strictly maintain isolation. If it is pharyngeal diphtheria, droplet precursor. If it is cutaneous diphtheria, contact precursor. Assist to administer diphtheria antitoxin as prescribed. Provide bed rest. Assist the administration antibiotics. Provide humidified oxygen and provide tracheostomy care if tracheostomy is necessary. Next disease is called Poliomyelitis. But organism name is enteroviruses. Incubation period 7 to 14 days. The source oropharyngeal secretion and phases of an infected person. How it is transmission? Direct contact with an infected person, or fecal-oral, means fecal, oral, or oropharyngeal route, also the source of infection. So, what are the presentation? Key symptoms: patient develop fever, malaise, anorexia, nausea, headache, and so forth. So, because of the vaccination, polio vaccine, the poliomyelitis is almost eradicated from the world. It is very good news for us. Abdominal pain followed by soreness and stiffness of the tongue, neck, and limbs that may have progressed to central nervous system paralysis. In this picture, unfortunate boy developed the osteomyelitis because of the paralysis in the central nervous system. So what are the intervention? First of all, maintain the contact precursor or supportive treatment, bed rest, monitoring for the sign of respiratory paralysis. If respiratory muscle paralyzed, difficult to respiration and patient die, and physical therapy. Scarlet fever. So, what are the organisms can cause scarlet fever? Group A, beta hemolytic streptococci. Incubation period 1 to 7 days. The source of infection, nasopharyngeal secretion of an infected person or carrier. Transmission, direct contact precursor. So group A, beta hemolytic streptococci is contact precursor. And now the signs symptom. First day of rash and third day. Patient develop flushing in the cheek, then white strawberry tongue. Increase the density in the skin over the neck, or transmit transverse line in the folded area, and also increase the density in the groin. But the third day of rash, we can see circummoral pallor, red strawberry tongue. At the beginning, it was white strawberry tongue, but later it red strawberry. Increase the density in the axilla and positive blanching test. So first day, white strawberry tongue, but third day, red strawberry tongue is a key symptoms of scarlet fever. So red rash, flushing face, sore throat, and red strawberry tongue is a cardinal symptoms of scarlet fever. So what are the sign symptom or key symptom? Suddenly high fever, flushed cheeks, vomiting, headache, enlarged lymph node in the neck, malaise, and abdominal pain. A red, fine, sandpaper-like rash over the axilla, groin, neck, and spread to cover entire body, except the face. And also desquamation means a sheet-like sloughing of skin on the palm and sore. The tongue is initially coated with a white, furry covering with a red projectile papilla, which is called white strawberry tongue. But the third to fifth day, the white coat turn off and leave a red, swollen tongue, which is called red strawberry tongue. Tonsil are reddened, edematous, and covered with exudate. Pharynx is edematous and beefy red. Intervention, we always follow the contact and respiratory precursor within 24 hours after initiation of antibiotic therapy. Provide supportive therapy, provide complete bed rest, and encouraging fluid intake. Now, let me talk about the Kawasaki disease. So, what is the Kawasaki disease? It is an acute systemic vasculitis. Means systemic vasculitis, inflammation of the blood vessel in the body. The cause is unknown. The sign and symptom in acute phase, patient develop high fever. So you see the fever is more than 102 Fahrenheit. And this high fever is unresponsive to antibiotics. Patient develop red eye and dry eyes, which is called xerophthalmia, conjunctivitis, redness, and patient develop red lips. Lips is red lips. Patient develop red tongue called strawberry tongue, and also red oral mucosa with the edema of the oral mucosa and pharynx. And also red, you see the red palm or sole, red, here, picture red sole. Swelling of the hands and feet. If you check the lymph node, enlarged palpable lymph node includes cervical node, or cardiac symptom develop, cardiac complication means dysarrhythmia or myocarditis. So rash over the tongue and peripheral area, occasionally intermittent colicky abdominal pain, pallor and proximity like fingernail or toenail, especially skin layer discomet easily. Now question come, if patient have Kawasaki disease, what are the medication? We give them gamma globulin and high dose aspirin. And what are the nursing care? We monitor the cardiac function because cardiac complication in 5 to 20% patient. Daily body weight measurement, maintain strictly input-output chart, and educate the patient and parents to avoid live immunization for 11 months. Very important for NCLEX board. Next disease here is called Lyme disease. So Lyme disease means, you see, this is the ticks. So if this ticks infected, patient develop Lyme disease. And this organism or ticks is called the Borrelia burgdorferi. What are the signs and symptoms? The Lyme disease, early stage, late stage. Early stage, usually 3 to 30 days after bite, and late stage develop even 2 to 12 months after bite. So at the beginning or stage 1, patient develop fever, chill, headache, and fatigue. But the late stage, patient develop facial palsy, paralysis or weakness in the facial muscle, or large joint swelling, muscle pain, fever continue, fatigue. And very late stage or stage number 3, patient develop deafness or encephalopathy, speech problem, abnormal muscle movement, muscle pain and weakness, irregular heartbeat, dizziness, and key symptom characteristic feature is called bulla eye. Look like this. This one, you see, bulla eye or bull eye rash at the bite site. This one. And now let me go here. Symptoms of the disease. Stage 1, early localized Lyme disease. Stage 1, usually 3 to 30 days after bite. What is the characteristics feature? Bacteria have not spread throughout the body. Flu-like symptoms like fatigue, fever, headache, and muscle pain. A round red bullous eye rash that spread from site of the bite, and some people have no symptom at this stage. And stage 2, usually 3 to 10 weeks after bite. And also it's called disseminated Lyme disease. Bacteria begins to spread throughout the body and occur weeks to months after bite, headache, facial palsy, heart palpitation and shortness of breath, also pain or tingling in the hands, legs, feet is possible. The stage 2, the key symptom, paralysis and weakness in the facial muscle, large joint swelling, rash or muscle pain, fever and fatigue. And stage 3, it is usually 2 to 12 months after bite, late disseminated Lyme disease. Bacteria has spread throughout the body, can develop months to years after infection. Pain and swelling of the large joints is the most common. And in this stage, patient develop deafness, encephalopathy, and speech problem, abnormal muscle movement, and muscle pain or weakness is most common. So what are the treatment of Lyme disease? We give antibiotics like doxycycline. So single dose or 2 to 3 weeks course of antibiotics confirmed if the patient have it. Doxycycline and amoxicillin is a drug of choice. Next disease here, it is Erythema Infectiosum, or it is called fifth disease. The organism can cause fifth disease, human parvovirus B19 subtype. Incubation period 4 to 14 days. Source, infected person, means droplet or blood. How it is transmission, unknown, possible respiratory secretion, and blood. So Erythema infectiosum, the skin rash start from the face, appears like slabbed check, and maculopapular rash then all over the body, rash on arms, legs, and back. Let me read it. The key symptom before rash is symptomatic or mild fever. Sometimes patients do not have any sign symptom, or patient develop fever, malaise, headache, and runny nose. But the stage of the also stage of rash, this is called erythema of the face. This is the erythema of the face. We call appears like slabbed cheek, red rash on face, or maculopapular rash on extremities. The rash subside but may reappear if the skin is irritated or traumatized by factors such as sun, heat, cold, exercise, or friction. The child is not usually hospitalized. The pregnant women should avoid infected individuals, provide supportive care, assist to administer antipyretics, analgesics, anti-inflammatory medication as prescribed. So next disease here is called infectious mononucleosis. The organism can cause infectious mononucleosis or Epstein-Barr virus. Incubation period is 4 to 6 weeks, and communicable period unknown. The source is oral secretion and transmission by direct contact of infected person. The key symptoms: patient develop fever, sore throat, malaise, headache, fatigue, nausea, abnormal abdominal pain, enlarged red tonsil. Some patients develop lymph node enlargement or lymphadenopathy. Some patients develop liver enlargement or spleen enlargement, or both together, which is called hepatosplenomegaly, or a discrete macular rash that is the most prominent over the tongue may occur. In this picture, we can see in this different system get involved in infectious mononucleosis, like central nervous system, fatigue, malaise, loss of appetite, visual photophobia, tonsil, redness, swelling, and white patch. In the throat, soreness or reddening. Lymph node palpable, swelling, and lungs, cough, systemic, chill, fever, and aches. If you check the spleen, we get enlarged. We call splenomegaly, abdominal pain, or nausea. What are the intervention? Supportive care is important. Also monitor for sign of splenic rupture. Educate the patient of a child with a mononucleosis to monitor for sign of splenic rupture, which include abdominal pain or left upper quadrant pain or left shoulder pain. Next disease is a Rocky Mountain spotted fever. The organism can cause Rocky Mountain spotted fever are Rickettsia rickettsii. Incubation period is 12 to 14 days. And the source is a tricks from a mammal source, or most often from wild rodent or dog. So this is the infected tricks, egg of the tricks, and the carrier or source is a rodent or dogs. From rodent or dogs, it is transmitted to the human. So transmission, the bite of an infected tricks. Sign symptom, fever, malaise, anorexia, vomiting, headache, or myalgia, means muscle pain. A maculopapular or petechial rash primarily on the extremities, means legs or wrist, but that may spread to the other areas, and characteristics on palm and sole. So this is the characteristic skin rash over the extremities, ankle. So provide supportive care is important, or assist to administer antibiotics. Re-educate the teaching to the child and parents about the protection from the bite. So here showing how we can prevent it. Rocky Mountain spotted fever. So feature to protect the child from the tricks. So it is good to wear if you go in area where the chance to Rocky Mountain fever, and it is good to wear the long sleeve or wearing the light color clothing, or checking the children for presence of tricks after being in the high risk or trick infected areas. Because Rocky Mountain spotted fever is an infectious disease with a characteristic rash, often transmitted by bite of sticks. Because it is a potentially a fatal disease that is usually caused by the bite of a tricks. Following the path rather than the walking in a tall grass, right? Because these are the place where the most tricks are found. It is good to apply the DEET before to start to go. So you see the picture, The causes of Rocky Mountains spotted fever and spending more times to the outdoor who are there. So keeping the yard at the home trimmed and free of accumulating leaves or other bush. Applying the ticks repeller to dogs, saving the ticks for later identification if it is removed from the child body. You can save it, the tricks for identification of the treatment. To remove the tricks or at the point of closest contact of the skin, it is good to wash out and remove and remaining part with the sterile needle. If using bare hands, use a tissue during removal and also wash the hands with a soap and water.